with the second part, that is landmarks of maxillary radiograph or the landmarks seen in maxillary IOPA. As we can see, the first landmark is the intermaxillary median suture, intermaxillary or median suture. The location of intermaxillary or median suture is it is an immovable joint located between the right and left half of maxilla. It is located between the right and left half of the maxilla. As we can see in this IOPA appear as a radiolucent structure. It appears radiolucent. Radiolucent means black or dark. It is a thin line between the two portions of premaxilla. As we can see here, a radiolucent thin line between the two portions of premaxilla. It is known as intermaxillary or median suture. The second landmark we are going to see in IOPA is anterior nasal spine. Anterior nasal spine is nothing but the continuation of median suture. The location is sharp projection of maxilla in midline, junction of inferior end of nasal septum and intermaxillary suture. As we can see, this is the nasal septum. This is the nasal septum. It is situated between the junction of the nasal septum and intermaxillary suture. It appears as a V shape. It appears as a V-shaped radio opacity. As we have seen earlier, radio opacity is nothing but white or light structure. It is 1.5 cm or 2 cm above the alveolar crest. It is 1.5 to 2 cm above the alveolar crest. Radiographically, it appears V-shaped, radiopaque at the intersection of nasal floor and nasal cavity. This is the nasal floor and the black part is the nasal cavity. Cavity is an air-filled space, so it appears black or radiolucent, and nasal floor is a bony structure. It appears radio-opaque or white in color. The third structure that we are going to see is nasal cavity or nasal fossa. Nasal fossa or cavity is nothing but a air-filled space or a empty space. So it is located above the oral cavity. It is located above the oral cavity. This is our oral cavity. It is located above it, either side of nasal septum. This is our nasal septum. It is located either side of the nasal septum. It is a large radiolucent area. Radiolucent means dark or black color structure above maxillary incisors. These are our central incisors. These are our lateral incisor. It is situated above it. It is situated above maxillary incisors. As we can see, this is the nasal septum. How it appears? Radio opaque. This is the nasal fossa. It is a cavity. How it appears? Radiolucent. This is the anterior nasal spine. It appears V-shaped and radio opaque. This is the nasal cartilage. It also appears radio opaque. This is the inferior conchae. Conchae is a bony structure. It also appears radio opaque. Median palatine suture it appears radiolucent. These are the structures seen in the anterior maxilla. Now coming to the fourth structure, that is the floor of nasal cavity. This is the floor of nasal cavity. It is made by two parts, that is palatal process of maxilla and horizontal portions of palatine bones. As we have seen in development of head and face, that there are MXP, maxillary process, medial nasal process, lateral nasal process. From MXP, the part of MXP, that is palatal process, and the bones of palate horizontal portion together make the floor of nasal cavity. They make a bony wall which is known as nasal cavity. Floor of nasal cavity. It is a radio opaque structure. It is a floor. Cavity appears radiolucent, but the floor appears radio opaque. It is a radio opaque band of bone above maxillary incisors, where it is situated above the maxillary incisors. This is the floor of nasal cavity. It appears radio opaque, means white or light in color. This is the nasal septum. Nasal septum again is a radio opaque structure, but it is vertical. It is nothing but a partition between the right nasal fossa and the left nasal fossa or cavity. It is a vertical bony wall. Any bony structure means calcification. Calcification appears radio opaque or white in color in radiograph. The sixth structure we are going to see is the inferior nasal conchae. Conchae is nothing but the extension of bony structure. There are three nasal conchae: superior, middle and inferior. So we are talking here about the inferior nasal conchae. It is nothing but a thin curved plates of bone. It extends from lateral wall of nasal cavity. From where it extends? This is our nose. This is the lateral wall of nasal cavity. This is the lateral wall of nasal cavity. It extends from the lateral wall of nasal cavity. Extends from lateral wall of nasal cavity. It is nothing but a thin curved plates. How it appears? Curved. How it appears? Curved. It is nothing but a bony structure. So again calcification, it will appear radio-opaque mass or projections within the nasal cavity. It is again a bony structure. So how it will appear? Radio-opaque mass projections within the nasal cavity. As we can see here, this is the inferior nasal conchae. This is the inferior nasal conchae. The white structure, as you can see here, it is nothing but the inferior nasal conchae. Next structure we are going to see is nothing but incisive or anterior or nasopalatine foramen. As the name suggests, it is located at the junction of mid-palatine and incisive sutures behind central incisors in the midline. As its name's foramen is nothing but a hole. A hole appears radiolucent on the radiograph as it is a air-filled space. Air-filled or soft tissue-filled space. It is round or ovoid on the radiograph. It appears radiolucent area between the roots of the maxillary central incisors. As you can see here, these are our central incisors. The incisive foramen is located somewhere here, round or ovoid structure. This was about the incisive anterior or nasopalatine foramen. The next structure we are going to see is nothing but the soft tissue of nose. Any soft tissue appears on the radiograph. Soft tissue of tip of nose appears on the IOPA. It is nothing but a superimposed over roots of maxillary incisors. It is superimposed. These are our maxillary incisors and this is the soft tissue of nose. So it is superimposed on the maxillary incisors. It is superimposed on the maxillary incisors. It appears slightly radio-opaque with sharp borders. It is appearing very sharp borders and a radio-opaque structure. The soft tissue of nose appears radio-opaque with sharp borders. Now, these were the structures that we can see mainly in the anterior region of the maxillary IOPA, that is central or lateral incisors. What are the structures we saw? Intermaxillary or median suture, anterior nasal spine, nasal cavity or nasal fossa, floor of nasal cavity, nasal septum, inferior nasal conchae, incisive anterior or nasopalatine foramen, soft tissue of nose. The next structure we can see in the region of lateral incisors are lateral incisive fossa. Fossa is nothing but the depression or cavity. Lateral or incisive fossa, depression in the maxilla near lateral incisor. It appears diffuse as a diffuse radiolucency around apices of lateral incisors. As we can see here, this radiolucent structure, diffuse radiolucent structure, is nothing but lateral or incisive fossa which is located around the apices of lateral incisor. The next structure we can see is inverted Y line of Ennis, which is one of the most important Viva question. It forms between the intersection of floor of nasal cavity and floor of maxillary sinus. As we can see, this is the floor of nasal cavity and this is the floor of maxillary sinus. It is appearing somewhat Y in structure. As we can see, it is appearing somewhat Y in structure, therefore it is known as Y line of Ennis or inverted Y. It is not a true anatomical landmark but seen only on radiograph due to superimposition of the floor of the nasal cavity, straight radio-opaque line, and border of maxillary sinus, curved opaque line. The maxillary sinus appears curved while the floor of nasal cavity appears straight. This is the Y line of Ennis. This is the Y line of Ennis. This is the Y line of Ennis. On the radiograph, as we can see, it is a superimposed structure, so it of soft tissue, so it appears radio opaque. It also appears as upside down Y and formed by the intersection of nasal fossa and anterior border of maxillary sinus. Anterior border of maxillary sinus. The next structure we have to see is nothing but the floor of maxillary sinus, which also forms the Y line of Ennis. It is a paired cavities of bone. Sinus is nothing but a cavity, so it will appear radiolucent, but the lining of the sinus is a bony structure, so it will appear radio opaque. So it appears as a thin radio opaque line. Maxillary sinus, as the name suggests, it is located in the maxilla, passing near or crossing apices of molars, where it is situated near the molar region in the maxilla. So it is passing near or crossing apices of molars. These are our molars and this is the maxillary sinus. So it is passing near or crossing apices of molars. The next structure we have to see is nothing but maxillary sinus septa. Maxillary sinus septa is nothing but the division of maxillary sinus by thin bone known as bony septa. Maxillary sinus septa is also known as bony septa, which divides the maxillary sinus vertical from maxillary sinus. How it appears? Vertical, thin radio opaque line, as it is a bony structure, so it will be calcified, so it will appear radio opaque or white in color. Maxillary sinus septa is nothing but the division of maxillary sinus. The next structure we are going to see is nothing but zygomatic process of maxilla. Zygomatic process, as the name suggests, it is something related to bone. So how it will appear? Radio opaque of maxilla. A location of it is apices of first and second molar. The apices of first and second molar, extension of lateral maxillary surface, first plus articulate with the zygomatic bone. This is our zygomatic bone. So this three forms the zygomatic process of maxilla. It is located near the apices of first and second molar, and it is formed by the extension of lateral maxillary surface, which articulates with the zygomatic bone. It appears J or U-shaped radio opacity. How it appears? J or U-shaped radio opacity at the apices of first maxillary molar, open end superiorly. Where is the upper? If we say it is a U or J structure, where is the open end? Open end is towards superior part. Zygomatic process of maxilla. This was all about it. Now the next structure is zygoma, which is nothing but our cheekbone, also known as molar bone, also known as zygomatic bone. As the name suggests, it has bone, so how it will appear? Radio opaque. Zygoma plus it articulates with the zygomatic process of maxilla. As we have seen earlier, this was the zygomatic process, but this is the zygoma. Zygoma articulates with the zygomatic process to form a diffuse radio opaque band, as we can see here, extending posteriorly from zygomatic process of maxilla, where it extends posteriorly to the zygomatic process of maxilla. The next structure we are going to see is nothing but maxillary tuberosity, as the name suggests, and we know it is a bony landmark, so it will appear radio opaque bulge. It is a rounded prominence of bone, extends posterior to the third molar region. Always maxillary tuberosity, as we can see in this diagram, it always situated posterior to the third molar. Radio opaque bulge we can see distal to the third molar region. Distal to the third molar region is nothing but the maxillary tuberosity. The next structure is pterygoid plate. Pterygoid plate is made up of two parts of sphenoid bone, medial pterygoid plate and lateral pterygoid plates. Immediately posterior to the tuberosity of maxilla, we can see the pterygoid plate. Where we can see the pterygoid plate? Immediately posterior to the tuberosity of maxilla. This was our tuberosity, and immediately posterior to the tuberosity of maxilla. As we can see, it is a plate or it is a part of bone, so it will appear radio opaque or white or light in color, and it will show as a homogeneous shadow. No evidence of trabeculation is seen in the pterygoid plate. As we have discussed earlier, no evidence is seen in the case of pterygoid plate. It is nothing but a homogeneous shadow. This was our pterygoid plate, which appears as a homogeneous shadow. The last part is the hemulus. The last structure we can see in the maxillary IOPA, which is of clinical importance, is the hemulus, also known as hemular process. It is nothing but a small hook-like projection from medial pterygoid plate. As we have seen, sphenoid bone is differentiated into medial pterygoid plate and lateral pterygoid plate. Medial pterygoid plate, small hook-like projection called as hemulus. Okay, as we can see, it is a part of the bone. Medial pterygoid plate forms the medial hemular process. So it will appear radio-opaque or white in color, radio-opaque hook-like projection posterior to the maxillary tuberosity area. This was our maxillary tuberosity area, and this part is nothing but the hemulus, and this part is nothing but the hemulus, which is situated posterior to the maxillary tuberosity area. It is the continuation of medial pterygoid plate, which was also situated posterior to the maxillary tuberosity area. This was the structures seen in the posterior region of maxillary IOPA. We saw lateral or incisive fossa, which appears radiolucent, inverted Y line of Ennis, which appears radio-opaque, floor of maxillary sinus, which appears radio-opaque, maxillary sinus septa, also known as bony septa, which appears radio-opaque, zygomatic process of maxilla, which also appears radio-opaque, zygoma, which also appears as radio-opaque, maxillary tuberosity also appears as a radio-opaque structure, and pterygoid plate also appears as a radio-opaque structure, and hemulus is a part of pterygoid plate, so it also appears as a radio-opaque structure. These were the structures seen in the maxillary IOPA, which are of clinical importance. To summarize, in the maxilla, in the incisor region, the radiolucent structure or black structure or dark structure, which are seen incisive foramen, nasal cavity or fossa. Foramen is a hole, cavity is a hollow depression, or fossa is the same part. Lateral fossa or incisive fossa, mid-palatal suture, superior foramina of nasopalatine canal. Which are the radio-opaque structures seen in the incisor region? Nasal septum, form of the which is nothing but bony wall, floor of nasal cavity, which is also made up of bone, anterior nasal spine, also made up of bone, inferior nasal conchae, also made up of bone, hook-like projection, or we can say curved projection. Soft tissue of nose, which is formed by the superimposition, is also radio-opaque. In the canine region, we can see radiolucent structure like nasolacrimal duct, as it is an empty structure, so it will appear radiolucent. Nasal cavity contains air-filled space or empty structure, it will appear radiolucent. Maxillary sinus also contains air-filled cavity, it appears radiolucent or black. Lateral fossa means cavity, so it appears fossa means cavity, so it appears radiolucent. In the canine region, the radio-opaque structures seen are inverted Y line of Ennis, which is made by the intersection of the floor of maxillary sinus, which appears curved, and floor of nasal cavity, which appears as a straight line of Y. Lateral wall of nasal fossa, that is wall means bony structure. Anterior border of maxillary sinus, again bony structure, appears radio-opaque. Floor of maxillary sinus also appears radio-opaque. In the premolar region, the radiolucent structure seen are nutrient canals within maxillary sinus. As it is a canal, so it will contain fluid or any other thing, so it will not be shown in the radiograph, so it will appear radiolucent. Also the maxillary sinus again appears radiolucent. The radio-opaque structure are septa within maxillary sinus, it is a bony part which divides the maxillary sinus, so it will appear radio-opaque, and borders of maxillary sinus, same, it will appear radio-opaque. while the last region, that is in the molar region, the radiolucent structure are again maxillary sinus, nutrient canal with more sinuses. In the molar region, the radiopaque structures are located. They are septa within maxillary sinus, border of maxillary sinus, maxillary tuberosity, hamular process, which was the continuation of the medial pterygoid plate, zygomatic process of maxilla, and zygoma. A zygoma was made with the help of zygomatic process, coronoid process of mandible. As we know, this is the coronoid process and this is the condylar process of mandible. If we are seeing the sagittal section, this is our coronoid process, and this is the condylar process, which takes part in the temporomandibular joint, this one. So coronoid process of mandible is also a bony part, so it will appear radio-opaque pterygoid plate. As the name suggests, plate means made up of bone. It will also appear radio-opaque, and hamulus will also appear as radio-opaque. Hamulus and hamular process are two same thing, which appears J or U-like structure where the opening is situated superiorly, superiorly. This was all about the part 2 of landmarks seen in maxillary IOPA. Stay tuned for part 3.